Today on The Operators, we had Dr. Hoedebecke, who is our first doctor we've had on the show that's also in venture capital in VC. So we talked a bit about VC, talked a bit about being a doctor, and it was a pretty solid episode. So hopefully you enjoy.
You can go all the way back. My parents were both in related to healthcare. My dad's a veterinarian and did most of his work in pu human public health with the U.S. Army. My mom's a dietitian and served for 30 years in the Army as a dietitian, so was around healthcare all the time. And then I went to West Point, and they let a percentage of the graduates go directly into medical school. I was really interested in the human body, how it worked, science. So went for that. I was able to get in. Went directly to Uniform Services University, and then I did my specialty in family medicine. I did kind of a non-traditional career for most doctors. Because I was in regular inpatient, outpatient, full scope medicine roles, but then I was also medical director within an aviation medical unit within an airborne unit. So not only taking care of folks jumping out of airplanes and helicopters, patient, loading and transport with helicopters, but also doing those things myself. So that was pretty cool being out in the actual thick of things. And then where I am today, got out of the military 2019, was the first medical director of utilization management at a startup that went public in 2021. And now I run a healthcare venture firm on one hand, and on the other hand, I still see patients in the regenerative medicine space.
So let's start with regenerative medicine. So what are you doing clinically then for regenerative medicine?
Yeah, so clinically, regenerative medicine, so big kind of three treatments there are exosomes, stem cells, peptides. You're probably hearing a lot about peptides these days with the
We were
most
talking about it in an earlier episode, actually.
very cool. Yeah, the most popular being, the GLP-1s for diabetes, weight loss, are also peptides. But peptides are more the size of the molecule rather than the function. So there's about five different functional areas that I treat people with.
So then, and also like dive into, so the clinic is like physical? Do you do telehealth as well?
Yes,
How many staff?
yeah, concierge. So it's right now it's just myself as the sole physician. It's I do see patients in person on a concierge modality. We are getting a brick and mortar here in the next month or two, but right now it's either been home office or patient's um, location of choice, and then also telemedicine as well.
So then, does that mean you're probably cash pay?
All cash pay, correct.
And why have you chosen that route?
Um, so the startup I mentioned that went public was a health insurance startup. So I've seen it from that side and all the chaos on that side. And then I have done some clinical roles with some of my startups within my portfolio, and then having to deal with insurance is just a pain in the ass.
Why is dealing with insurance a pain in the ass?
How much time do you have?
I always ask it to everyone. I love asking doctors about insurance. It's a great talking point. Low hanging fruit.
Yeah, it's pain because you have to submit for payment. Payments are delayed. They don't always get approved, and then you have to fight. Often not have to fight to even get those approvals after a service that they say they're going to cover is not covered.
Got it. So all cash pay, physical location, and then with peptides, I'm curious like what your kind of workflow and thoughts are on peptides. It's also another kind of very interesting topic we sometimes chat about.
Yeah, so the folks I generally treat are, um, I would say generally healthy, not always the case, but generally healthy, looking to maintain that edge. So I have athletes, I have executives, so there's physical edge, there's a mental edge. They want that continued clarity. They want to delay burnout, things like that. Of course, I practice and compete in jujitsu, so I get
Mhm.
injured, and I'm around people who get injured quite a bit, and they enjoy using different peptides that help them heal quicker.
Mhm. And so do you recommend peptides as most like are you do you actually recommend them to most patients then you think it is worth
It,
it per se
yeah,
or is it
the worth it is that'll have to be the patient choice. So it depends on budget,
Mm,
on what goals are. Sometimes goals can be unrealistic, and I would say, okay, it's not worth it because you're never going to get to that goal with a peptide.
mm,
If we can set realistic goals and provide these peptides in a safe manner, also where do you get your peptides from? That's a huge conversation in of itself. So we only have
mm.
clinical grade, not research grade peptides. And then pr because it is cash pay, price does come into play as well.
Got it. And then I thought it was kind of interesting going into your VC background. You're an associate producer on America's Real Deal. I kind of wanted to dive into that as well.
Yeah. So I'm sure you've seen Shark Tank or
Yes.
Dragon's Den from Canada, but I grew up watching that in my teens, early 20s. I think it was on in my late teens. Maybe it's just my early 20s. But I was like, man, it's so cool. I'd invest in that, or oh, I'd buy that product. I know one of those products was Scrub Daddy, which I was just using today
Yes.
uh, on Shark Tank. But had the opportunity to take it to the next level. So instead of saying, "Oh, I would buy that" or "I would invest in that," you now have the opportunity to do that, which is what America's Real Deal does. We have a Shark Tank-esque show, but using crowdfunding, which has become more and more popular over the last 5, 6, 7 years. We're able to set up a program where the actual viewer can either buy the product directly or they can invest directly through crowdfunding.
Awesome. And it's been on since 24 or 2024.
We filmed in 2024, it released in 2025, I think in August of 2025.
Awesome. That's super cool. So, how did you go from medicine to like venture capital? How did that transition happen?
Great question. So when I got out of the military, I was just looking for leadership roles and happened to find a space in a health tech startup that was in a non-clinical role. So I say that was my first foot in the door. And then I was able to help them grow, see what a startup environment felt like, and it was just really invigorating. And I felt like I had a lot more autonomy than I did
Yeah.
position. And I felt like I was able to affect more people. So when you're a physician, you're usually treating one person at a time, which we need. But when we're working on solutions that treat populations, I'm able to affect more change. So I like that aspect as well. And then we had an IPO, and I was like, oh, this is really cool. Um, let's let's kind of hang out and stay in this area of medicine on the cutting edge, making that change in medicine we all gripe about, but don't necessarily do anything about. So I'm actually able to make that change that I've wanted to see for so many years. So that's really how I got into it. I started doing some angel investing, which is just basically, me investing as an individual. Did got a pretty
Mhm.
on choosing startups in which to invest, and then joined forces with um, a team to make 1836. 1836 being the year of the Texas Revolution. I get that question a lot. So very Texas centric. And then from there, we finished our first fund. We're working on our second fund right now, but we have 8 companies in our first fund. It's about at 8 million, just over 8 million. We wanted 5 million, but we oversubscribed to 8 million, which is a nice problem to have. And we have I'd say three of the eight are could potentially be unicorns. Then the others are doing pretty well as well, just not unicorn status.
Yeah. And I'm trying to open the website, but it's not letting me
Oh yeah,
join.
it's I think they're adjusting the website right now for 1836.
So I was gonna say, so what's the portfolio then look like? It's like med tech or just not even medical? Because I can't see it. That's why I'm not
Yeah,
very
sure,
prepared.
absolutely, man. It's a lot of we got a couple SaaS solutions, some tech solutions. So like one example is called Sensei.
Mhm.
It's an app you have on your phone, and using that app, it's able to read your face, and you're actually able to diagnose with a 90% accuracy behavioral health conditions like depression, anxiety, PTSD. Not only can you diagnose them, but you can also see how treatment is going. So say this sensei says, yes, uh, Ben, or excuse my name, Kyle, yeah, you
You did very
like
fun.
depression based on your sensei score. We're going to start you on an SSRI, which is usually the first line of treatment. And then a month later, oh, your scores have improved. So it's actually showing an improvement as well as an efficacy of that medication.
Mm,
Cool, because it's
interesting.
the first objective diagnostic tool in behavioral health. Because what do we do now? It's like a questionnaire. Do you feel tired, more tired than usual? Are you eating more, eating less? Are you not happy with things that you're usually happy with? Are you guilty about anything? So you have all these subjective markers and no objective markers. So this is the first time we actually have something objective in behavioral health.
Interesting. But would it be like from a Zoom call or would you film yourself? Um,
Yeah, it's an actual app on your phone. So it would
mm.
be your own phone.
And then is there anything else that's interesting in the portfolio as well
Oh yeah,
that
there's
stands
also
out?
I'd say they're all interesting. So
They're
that
all
that's
interesting. Yeah.
that's super interesting. So that's the diagnostic side. On the treatment side, we have one called Harvard MedTech, which is a VR platform for the treatment of those same behavioral health conditions, but it also treats insomnia as well as chronic pain. So it's able to get significantly reduced pain scores, get people and keep people off of opioids since we had, this
Mm,
crisis. Some people have even been able to use that modality, that VR headset, through surgery. They didn't need to be take drugs to knock them out, no general anesthesia. So that's pretty cool. It's very effective. Been published in two of the three best journals in the world. We've just gotten to the VA, Veterans Affairs, the last couple of years, and helping tons of veterans, as well as using standard insurance as well.
and I mean, this is such a broad question, but like, what makes a company worth working with or investing with? Like, it's
Yeah.
so broad, but I have to ask.
Right. Yeah. So my initial question, if I'm going to be interested, I have three things. So the team, the tech, and the traction. So the team, they need to be like hyper focused on what they're doing. They need to be this needs to be their livelihood.
Mhm.
If they've had a previous exit before, I mean that shows history of past performance, so that is exciting. Or if they haven't, like in Sensei, the David, the CEO, hasn't, but he's surrounded by people with multiple exits, and he is like hyper focused on making sure this is a success. So that made it really interesting for me as far as the team. The tech has to be making medicine or health, better. Better can be reducing inpatient admissions, reducing ER visits, reducing cost, improving
Yeah.
patient satisfaction or patient compliance. So something that's going to improve objectively healthcare. And they need to have like a moat, either IP or some sort of way to protect what they have and can't just have a copycat come and take your idea. And then traction is going to be in the form of paying customers, in the form of grants, in the form of publications, contracts, things like that.
And how do you exit a company? What's the strategy?
So our strategy for 1836 is through acquisition. Did go through an IPO, was a great experience, but I'll be happy if I never have to do that again. There's lots of more regulations, and uh, my stock, for example, my stock was held up in a lockout period, and then had
That
lost.
must be an amazing feeling, though.
It was
Like,
a cool, yeah, it was cool to be a part of that. It was not cool watching the stock go from like $37, $39 down to like $10 though.
I
I
had
was,
that happen to me. I know, like,
I was just watching.
I owned like a REIT ages ago, and it got sold, but not all of it got sold. So it was hilarious. Like, the stock just tanks, and
Yeah.
then all this money just appears in your account. It's like the weirdest thing ever. You're like, what?
Exactly. I'm just like, there goes, there goes zeros, there goes all my zeros. So I didn't like that. And then the regulation part is just crazy, as well. So I'd prefer, we strictly work with companies that want to be acquired.
Yeah, it's funny. Like, I haven't shared too much with you about Caesar Health, and our CEO at Caesar Health. He has a lot of experience in tech, but I'm in my head. I'm like, do we check all these boxes? I think relatively we do, but it's funny. Like our moat is like it's so painful to work with EMRs that that's like our moat is that getting on all these marketplaces is just so brutal. It's like good luck for
Yeah.
someone else trying to do it.
Yeah, and when I don't know if this still stands, but when I was in the army, one of the top three reasons physicians left the military was the EMR. That's crazy to think
What do they
about.
use in the army for an EMR?
It was called Alta. I don't know what I think they've updated it now. I don't remember what that stood for, but
Gotta go on Epic.
right. Yeah, it was one of the top three reasons. So it was like money, deployment, EMR.
So let's talk a little bit more about your military career then. Like what were the takeaways from the army, would you say?
Um, I'd say so. Like my second to last year, well, my last 3 years, I was put in charge of one medical clinic, and then two, then three, then four. Um, and was a help being able to turn around metrics of value. So reduced image like unnecessary imaging, reduced readmissions, reduced follow-up visits. Um, um, so I was able, I'd say, just looking at not just clinical medicine, which is pretty similar in and out of the military and civilian life, but I was able to take on those leadership roles and look at the system of medicine as well.
Mm,
Was able to make a big change and positive improvements and in a lot of different areas, just improving how we delivered medicine, um, not including the clinical aspect. So just the patient flow and patient feedback and compliance with medicines and getting their imaging and getting their preventive healthcare and how to improve that, ensure our whole population became healthier as a result. I'd say that's non-clinical, like I'm not, providing antibiotics or getting x-rays for somebody, but I was making a difference on the leadership level. And the Surgeon General of the Army actually selected me as the Physician of the Year. I think it was 2017 for those changes. And they weren't even, I'd say, acting as a doctor. It was more just improving how we delivered healthcare.
and you were in Korea for 3 years, correct?
Yep.
Um, and were there any takeaways from Korea specifically?
Yes, there's I'd say two main things that kind of stuck out while I was there because we did have a lot of involvement with the Korean healthcare system. So one, I they do not give out opioids, so Percocet, even oral opioids, Percocets, things like that.
Mhm.
There's basically cancer or some sort of major like back or traumatic like car trauma, polytrauma situation. So I would have people, Americans, go get a knee replacement, and then standard of care here is at least give some Percocet or something along those lines post-surgically. Like, yeah, they would be coming to us after getting a knee replacement on the Korean system. Like, yeah, they just gave us Tylenol or
Yeah.
Motrin. Like
We had a
they do
doctor on like that actually a couple episodes ago, funnily
they
enough.
do
He was like, I
not
don't
give
go
us
with
opioids
opioids.
at all. I was like, wow. So I was like, okay, that's different. And again, I'd say we probably baby our folks. That's my
Yeah.
opinion. We we obviously have pulled back on the opioids. I remember in training, I'd be doing my surgical rotations. They're like, yeah, give them 100 Percocets so they don't come back. And now that'd be malpractice. Um, but just the kind of switch in view since we have seen the dark side of opioids over the last 10, 15 years now. The other thing
Yes,
is
and we already covered this on another episode, this scandal. Like it's already, I'm actually turning it into a short now that for the channel. We'll be like covering the
Gotcha.
history of it.
Very cool. Yeah. I wrote a book with a yoga therapist, looking at how we could empower patients to use different yoga positions, movements, as a therapy, not only for pain, but for other things, insomnia and other chronic conditions as well. So that was kind of fun, personal achievement that came out of the opioid epidemic. Because I started writing it when I just saw it in my patients just coming back for opioids that I would say didn't need them anymore. They got them after a tooth extraction, and they're like, "Oh, it still hurts." And I'm like, "That was 5 months ago. I'm not giving you more opioids." So just looking at ways to empower patients. And then the other thing from the Korea system is their insurance will like cover, I can't remember, it's every year, every other year, but like a full imaging of the body. You can
Mhm.
get that done here, but that's like part of their insurance system. They're like, oh, we're gonna go get our full body scan this year. I'm like, wow, that's unique. So that's a different approach compared to what we have here. There's good things because you find things earlier, but bad things because you may find things that wouldn't necessarily need intervention. Like, oh, there's this 2 centimeter mass. Now we got to work it up because you can't unsee that. So it does,
Mhm.
those types of things can cause additional dollars in the workup needing to potentially find benign growths or mass or things like that. But again, the positive is, oh, you can catch something that's malignant earlier.
Got it. Got it. No, it's such an interesting, like you have such an interesting history here just on your LinkedIn, and there's a bunch of stuff I kind of skipped as well. You just have so many little things to that history within you. But I was curious, like, what does the future look like for you with everything you have going on? Uh,
What does the future look like? So I'll still continue my regenerative medicine practice. It's and one keeps the clinical touch. Plus, it's very interesting personally as I try to. I was a Division I athlete and just trying to keep that high level of physical status and mental status and what I do. And then we'll be having a second 1836 fund coming out in the next couple of months. One of our 8 companies in our first portfolio is actually in acquisition talks. So we'll be launching the second fund, using that as a springboard. And then what else? I guess professionally, those are kind of the two big things. Anywhere I can kind of get involved. I'm doing some little side hustles, helping other health companies that may not fit in our thesis. Either they're too
mm,
small, not, I guess, right for the fund, but helping a couple other funds, excuse me, other companies on the side, get off the ground and become successful as well.
awesome. Thank you so much for coming on the show. I really appreciate it.
Yeah, my pleasure.